Hi, my name is Dr. Brad Muir. I am one of the co-developers and co-creators of the VMTX protocols that we use to try and treat various soft tissue injuries. I've also been a part of the team that's helped develop the VMTX Thumper massage unit, which we're going to show you how to use today. I'm here today with Dr. Courtney Brown. Today we're going to show you how to utilize the VMTX Thumper massage unit to treat a common condition of the foot called plantar fasciitis. Another condition that we'll go through and show you how to treat is the entrapment of the sciatic nerve, which can mimic a plantar fasciitis in the foot. And we're going to use the machine to show you how to treat the nerve all the way along its pathway, up from the foot all the way into the buttock area. In treating the muscles that are going to be involved in the plantar fascia type problems, looking at trying to identify and treat the plantar fascia itself, if I have Dr. Brown extend her big toe, coming in, you can see where the plantar fascia will come in and attach right onto the calcaneus. Now, there's a couple of different ways that I can try and treat this condition. One is that I can come in and try and just stick my thumb directly over top of the plantar fascia. She can reduce her foot down, take a little bit of the tension off. I can come in, place my thumb there, place the unit right on top, and I can start to use my thumb to initiate the vibration into that particular tissue. From here, I can have her extend her to dorsiflex her foot, dorsiflex her big toe, and try and work through some of the range. And just basically allowing the pressure to be maintained over top of that tissue as I treat it. Good. Now the plantar fascia is quite a large attachment that will come down in that helps support the medial arch on the foot. So I can also come in along the way and see if there's any tender aspects along the side of the plantar fascia to help try and peel some of that tissue off there. So doing the same, and as she dorsiflexes her foot and her big toe again, I can work through there a little bit. Good. And coming back down and extending through again. Excellent. Good. Now, the other way that I can utilize the machine is to come in and try and treat it over the whole length of that plantar fascia. So essentially, I can put her foot into a plantar flexed position, and I can work it through and along that whole plantar fascia. One of the other conditions that can mimic plantar fasciitis is actually an entrapment of the one of the branches of the sciatic nerve down into the foot. As the sciatic nerve travels down the posterior aspect of the leg, once it gets to a spot just above the knee, it will branch into the tibial and common fibular nerves. As the tibial nerve makes its way down, it will actually go through the tarsal tunnel on the medial side of the foot, and then underneath as it passes through that tunnel, it'll branch into the medial and lateral plantar, as well as a third branch, which is a medial calcaneal branch. As you follow down the medial plantar nerve, one of the spots that you can come in and palpate is called the knot of Henry. So the knot of Henry is where a lot of the different muscles and the nerve pass by at the same time, but it's a common entrapment spot for that medial plantar nerve. Where that nerve runs will often mimic the pain that the person can get with a plantar fascia type problem. So if I come in and put my finger on the knot of Henry, I can come in, identify where that nerve will run. I can come just off that tissue, place the vibration unit onto my hand, and I can use my thumb to try and manipulate the tissue to try and help peel some of it off of that nerve while utilizing the vibration unit itself. Excellent. So I can poke through there. The next part of it is I can have that patient dorsiflex their big toe and through their foot, and try and working it through that way. Good. Excellent. So then following the medial plantar nerve up through to where it goes towards the tarsal tunnel, just up just proximal to the abductor hallucis muscle, the nerve runs just underneath the navicular and then back in towards the tarsal tunnel. There may be a couple of entrapment sites through there, which I can go in and try and treat. And I can utilize that same technique all the way up through into the tarsal tunnel. Good. The other branch of the tibial nerve, once it passes through that tarsal tunnel, is the lateral plantar nerve. So the lateral plantar nerve is going to make its way towards the lateral aspect of the foot. As it passes near the plantar fascia itself, the first branch will go underneath that plantar fascia and can also get entrapped there. So the lateral plantar nerve, if we come in, if I have the patient activate that big toe, you can see where the plantar fascia is going to come in and attach. If I go just medial to that, that's where that lateral plantar nerve will run. So I can have her relax her foot down. I can palpate and see if that nerve's tender. I can come just off that and again place the vibration unit on my hand to try and help relieve some of the tension through that tissue. Good. So that's going to be the first branch of the lateral plantar nerve. The other branch is going to travel across to the lateral aspect of the foot. And again, you'll usually find a couple of spots where that's going to be quite tender. I can come in and utilize that vibration again through there. Good. And try and work on some of that tissue. You can essentially utilize the same technique for that medial calcaneal branch. If you're getting a condition that looks like a heel pad irritation, it can also be that other branch that comes in, that medial calcaneal branch. And you can utilize the same technique up into the tarsal tunnel as well. Good. Now I'm going to have Dr. Brown go on to her tummy, and I'm going to show you where the tibial nerve is, and we're going to work through some of the calf musculature to try and help treat the area of the soleal arch where that tibial nerve will pass just anterior to. In treating the tibial nerve at the soleal arch, you can identify that as the soleus comes across on an angle towards the lateral aspect of the knee. The soleal arch is where that tibial nerve will run through. I can identify just by palpating where that tibial nerve is. Usually it'll be quite tender as it passes through that soleal arch. Again, I can either come in, try and come just off that nerve, place the unit onto my hand, and try and work the tissue through with my thumb. Another way to try and come in and treat it is with a little bit of motion, and I can do that by, again, finding where that nerve is, and I can use my body and to try and put the foot into some dorsiflexion. At the same time, I can utilize the VMTX Thumper unit to try and work through the tissue just adjacent to where that tibial nerve is. Good. Now, in following up a little bit further along that sciatic nerve, where the nerve is going to branch, usually just above the popliteal fossa, it will branch into the common fibular nerve, which is going to go more lateral, or into the tibial nerve, as we just talked about. From there, I can also come in and treat the area where that branches and up into the hamstring. So the sciatic nerve is going to run the full length of the hamstring up into the buttocks, and so we can start to try and treat from that position, from utilizing the flexion and extension of the knee, and at the same time I can come in and try and plantar and dorsiflex that foot. Again, this isn't putting a lot of tension onto the sciatic nerve as yet. We'll get to that treatment in a second, but we can work that along the full length of the sciatic nerve, trying to relax the hamstrings, and then as we get up in towards the buttock, we can try and treat some of the treat the piriformis muscle, which can also put some compression onto that sciatic nerve. So I can have Dr. Brown go on to her side for me. So the last muscle that we're going to try and come in and treat that can cause some compression onto that sciatic nerve is the piriformis. So the piriformis, we can locate the greater trochanter. Piriformis is going to come in and attach there. It also will run just below where the sciatic notch is. That's where the sciatic nerve will actually come out. It will go anterior to the piriformis, so the piriformis is going to run across that way. And it's mainly an external rotator of the hip, until you get the hip up to about 90 degrees. So it's going to go change from that point into an internal rotator. So we can come in, again, we can utilize the machine directly across the piriformis muscle. Usually we'll be able to identify where there's some tender spots in there. The sciatic nerve is going to run up across and just underneath that piriformis muscle, and then we can start to put it through a bit of a treatment protocol from here. So I can take the patient's foot, and we're going to work the hip from internal to external rotation and utilizing the vibration at the same time. So I can come in, I can drop that ankle down, taking that foot into, or the hip into external rotation. And we can work it through that way. So that's going to help treat that piriformis muscle. And then if we want to try and stretch the sciatic nerve out at the same time, essentially I can take it down into an externally rotated position. I can move my body just slightly, and I can work that sciatic nerve all the way along into that medial aspect, into towards that tarsal tunnel area. And then coming back up, and try and get that to loosen off. I can drop down again and work it through the full length with it into a bit of a tension position along that sciatic.